Yep.
Hi, my name's Leesa, 186-12253, Leesa Heslop. I'm just going to be doing an administration of a S8 medication, oral. Just washing my hands. Okay, so I'm just reading the notes. We have Mr. Peter Pitt, 72-year-old man who presented to hospital post-trauma. He was in a pedestrian accident and he's got some injuries on the right-hand side of his ribs, abrasions and wound to the left leg. He's 72 hours post-admission, full primary survey's been attended, and he is for some oxycodone for pain relief. Okay, I also notice he's got a medication chart here, and he's also ordered, he's got the oxycodone, which is ordered, and I'll validate that in a moment, and he's also got some paracetamol. I'm just going to go and check with the patient. Okay. Hands. Okay. Oh, hi, Mr. Pitt. How are you?
I'm feeling a bit sore.
Oh, okay. Yeah, so you have been in a bit of an accident.
Yep, that's right.
Okay, oh, that's no good. My name's Leesa. I'm a student registered nurse, and I'm attending to you today. I'm just wondering, I've got some medication here for you. I'm just wondering if I could ask you a few questions and some details. Is that okay?
Yep.
What's your name?
Mr. Pitt.
Yeah. Get your first name, Pete?
Peter.
Peter. Yeah. And what's your date of birth?
It's it's the 1st of the 1st, 1945.
Are you allergic to anything?
Yes, I'm allergic to penicillin.
And what happens with that?
I get a rash.
Oh, okay. And I'm just going to check that against your armband. So it's Mr. Peter Pitt. Sorry to lean over. It's just your band is on the other side. Okay. 123754. Mr. Peter Pitt. Peter Pitt against the medication chart. Date of birth, 1st of the 1st, 1945, and I can see that you've got a red allergy band, which indicates to me that you do have an allergy, and you said that you are allergic to penicillin.
That's correct.
Okay, all right. So, Mr. Pitt, you said that you were in some pain. If 0 is the no pain and 10 is the worst pain, could you tell me what pain level you were in?
So it's around about an 8.
Around about an 8?
Yeah.
Okay. 8 out of 10, so that's quite a severe pain. Okay, so this oxycodone should be able to help with that. Could you tell me where the pain is?
It's down the left side.
Left side. Okay. All right. And down your left side on the leg. On the leg.
Yeah.
Okay. Yep. It said that on the leg. Okay. So I'll get you this medication. In the meantime, I do have to do a set of your vital signs. I can see that they were within range a little while ago, but what I'll do is I'll just do another set just to make sure that they are within range.
Yep.
This medication can cause a bit of respiratory depression. It can actually cause a bit of hypotension, which is low blood pressure, and it can cause you to feel a little bit dizzy and sometimes a little bit nauseous.
Yep.
So I like to make sure that your medication, that your observations are within a normal range before that we give that medication to you. I can see that they are within range, so I'd be happy to give that. I'm just going to go and get that checked. Here is your buzzer. If you need anything in the meantime, could you just let me know, and I'll be straight back. Otherwise, I'll be back in a few minutes with the medication.
No problem.
Okay.
Thank you.
Thank you. Okay. So I'm just going to validate the order, and am I able to get you to, I've got a second RN, am I able to get you to validate this order, please? Okay, so I have a Mr. Peter Pitt. I've just checked his ID band and just checked that with the patient. He's got a penicillin rash. So Peter Pitt, 1st of the 1st, 1945, Dr. Brown's ordered this medication. He's allergic to penicillin. It gives him a bit of a rash. That's been signed and dated by the doctor. The order is within date. There's a medication name. Oral, 7.5 milligram, twice a day. It's for pain. It's been signed by the doctor, and there's got a name there, and it's got a contact detail as well. So that's all the medication, 5 rights of medication, and it's also it has not been given for today. Okay, at 8. He's also ordered for some paracetamol, which I'm not going to be giving now, but there is some medication there that hasn't been given, but I'm just going to be giving the oxycodone today. Are you happy to validate that order for me?
Yes.
Okay, great. Well, with oxycodone, I'm just going to check the MIMS. Okay, so in the MIMS, it actually says that this drug is an opioid analgesic. It's for moderate to severe pain, and he is in a pain of about 8, which is quite severe. It can actually cause respiratory depression, arrhythmia and hypertension. The starting dose, 10 milligrams, and he's on 7.5, so that's within range. For oral, can cause a bit of GI upset, dry mouth and sedation and confusion as well, so I'll be monitoring for that. Monitoring all the vital signs. I've just done a set and they're actually fine, within range, signs for respiratory depression. Are you happy for that?
Yep.
Okay, so they're all within range and I'll be monitoring that every few minutes, every 15 minutes. Okay, you're great. So are you happy to come over to the drug tablet
Yep.
with me?
Yep.
Can we start again? Stop.